Do you have an open, non-healing wound from surgical treatment, bed sore, diabetes, or poor circulation, and you've been told to have your foot or leg amputated due to a bone infection? Don't you really deserve a second opinion? You may want a consultation with a doctor at St. Richard's Clinic on Socialville Foster Road in Mason, with decades of wound care experience. In addition to treating work-related injuries, St. Richard's Clinic also provides neighborly primary and urgent care services, with scheduled appointments, walk-ins, and telehealth visits. St. Richard's Clinic is currently accepting new patients and accepts most health insurance plans. St. Richard's Clinic is open Monday through Friday, 9 to 5, and Saturday by appointment. Schedule with St. Richard's Clinic online or call 513-306-4910. That's 513-306-4910.
Well, hello again, Dr. Obioha.
Hello again. I hope it works better this time. I think our audio problem is kind of improved now.
I think we're doing good. We're cooking with hot grease now, right?
Okay. Okay. Well, I apologize to the audience for that glitch. I think it was from my own end of the internet. That whole thing.
No worries, no worries. Well, at least we got you on here now, and you were telling us a little bit about your background and what led you to specialize in wound care and occupational medicine. Can we get you to tell us about that again?
Yeah, I had almost a decade of surgical training, both abroad and here, and then was involved in a lot of surgical research. And I felt I should use all that skill and knowledge to make a difference in society and not just stick ordinary general surgery practice. So I went in and obtained a master's in public health and also did a fellowship in occupational medicine just to have a focus of trying to utilize surgical skills to improve on wound healing, especially for the working population. So my aim in this whole practice is to see how you can quickly get patients who are in their working age, especially with the changing economic trends and the new budget that seem to emphasize more on people working in order to get their social benefits extended. We are here to support that whole process to make sure that people who are injured in the course of their work or they have wounds recover quickly and get back to the working force and able to earn a compensable living for themselves.
Wonderful, wonderful. So Doc, tell me, why is it important to raise awareness about diabetes, ulcers, and post-op care, especially in underserved communities?
Yes, diabetes is the biggest expense in the whole trillion-dollar healthcare system. It's the biggest money. In fact, diabetic foot ulcer, to be more specific, drags most of the funds in the healthcare. And that also circles around being able to walk, as being able to get out there and do some work and provide some kind of activity that generates an income. So the most underserved societies, as we describe, are further underserved if they have this problem. And unfortunately, they tend to have more commonly the problem. So that's one of the targets for us, is to see how we can assist these people with the resources that are available, make sure it's available to them to try and get them back to the working force. And I don't think there's a better time to make that case than now.
Okay.
Yeah.
So Doc, tell me a little bit about your clinic. Where are you located, and what kind of patients do you serve at your clinic?
So I'm located in Mason on Socialville Foster Road. The clinic is essentially a primary care preventive care clinic. We address preventive care issues like immunization. We also address occupational health related issues like patients who have been injured in their course of work. We provide assistance for their evaluation and recovery in the clinic. More importantly, I'm an expert in wound care. From the story I told you about my career and the experiences, I use that also to ensure that this population of patients, if they have wounds, I get them quickly healed and then back to the workforce.
So are there any unique services that you provide that other doctors in the area don't provide?
Yeah, we have everything that it takes to run a wound care clinic. We're about to get a hyperbaric oxygen chamber added to this. I am a sitting surgeon and wound care expert. Most wound care clinics don't even have an expert like me from my experience. So I am able to address post-surgical patients. I'm able to more effectively address diabetic foot related surgical problems and then more effectively address wounds that are chronic and try to get them to heal quicker. The whole thing about wound is to understand, just like you see a patient who comes in and complains of cough, chest pain, and you think, oh, this person is having a pneumonia. Every wound has a story. You want to know, is it a blood flow problem? Is it a nerve damage problem? Is it an infection problem? Is it a cancer? All that can be wounds. And whichever you determine it is, then you'll be able to start determine what treatments that would more effectively address that problem and get the wound to heal.
Wonderful. So tell me about for those people who aren't familiar, and of course, let me just say, I'm not a medical doctor. I'm not that kind of doctor.
I can understand that. Yeah.
You know,
So
people,
the thing about wound is one of those areas where a lot of emphasis is denied on wound care. But as far as I'm concerned, it's because of that denial that we have a lot of expense going in that direction. Most physicians don't like wounds. Most nurses I've met don't like the concept of taking care of wounds. They just see it as something a little bit degrading. For
mm,
me, it's an opportunity to make somebody's life better, to make somebody you see who is distressed, sometimes often depressed. And at the end of the encounter, depending on how long it lasts, that person walks away a happier and more renewed, rejuvenated person. For me, that is the idea of what medicine is supposed to do, not, and that's where I found my passion.
so tell me, what exactly is a diabetic ulcer and how does it develop?
So, a diabetic ulcer is just an ulcer occurring in a diabetic. Now, the question is, what is an ulcer? Anytime you have lost the status of an epithelial lining like the skin, the GI, whatever there is, what we call epidermis. That's a covering, a tissue that provides outer covering
Hmm.
for any surface. Is an epidermis. Is an epidermal structure. Once it's lost, that's the beginning of an ulcer. The question always is, what is the depth? Is the ulcer limited to the skin loss, or has it gone beyond to the underlying structures? And that stratification actually defines what the treatment is going to be if we're going to successfully reconstitute that epidermal loss. Now, when that happens in a diabetic, it is a diabetic ulcer. But the diabetic foot seems to be where most of the ulcers present because of the specific challenges that come to the foot of a diabetic. As we go along, I will point out the challenges with blood flow, the challenges with the nerve damage, the challenges with the vasculature, along with the entire metabolic challenge that the diabetic have to deal with. More often than not, they have a kidney failure, they may have a heart failure, they may even compound it with other failures. And all that just creates a whole dynamic. We look at it as the, the perfect storm. So you have an individual who is immune compromised due to diabetes, and then his circulation is not good. His immunity predisposes him to infection. His diabetes disrupts his nerves. He's not able to move around to get his circulation moving. His circulation by itself and diabetes is already compromised, and is also one of the reasons why the kidneys gets compromised in the process. So this person is just a walking around time bomb, waiting to express a lot of medical things that ultimately can challenge their health and may actually kill them. So the ulcer on the foot is where you tend to find diabetic problems. And for most of them, when they have a nerve damage, they are not able to recognize that there's something hurting them. So they don't feel the pain when it happens. Now, when they don't feel the pain, it means that that person can be burnt and wouldn't even know that it is burnt. That gives room for bacteria to get in there and cause the havoc. In addition to the loss of sensation, there is also loss of proprioception in the joints. That creates another condition we tend to refer to as the Charcot joint, where the joint is completely deformed. Those deformities lead to callosities, they lead to abnormalities in being able to ambulate, and ultimately limits the ability to ambulate. And the whole gamut of things with the poor circulation ultimately presents with different symptoms. More often, you see them with very severe forms of infection. The infections may be limited to the area, and more often may be able to spread to other parts of the body because of their poor immune system. It's just almost like the whole entire medicine can be read on looking at the diabetic and diabetic foot problem, because they present with almost every aspect of medical challenges that any individual can be confronted with.
So Doc, I'm noticing on one of the streams there is about 19 people watching right now.
Okay.
So how do we, as viewers and as people who don't really understand, there might be folks who don't even know they have diabetes, right?
Yes.
What are some of the signs and symptoms that someone is wrestling with diabetes?
So the first thing to start with, if you have a relative who has had diabetes, your mom, your dad, your sister, that's a good place to start. You start wondering, is it possible that, I too might have that problem? Now, even having said that, there are some diabetes that you have that may not have any family family connections to them, and they still will have the diabetes. So the question is, what are the things that you look out for that make you feel like this is a problem? So one is, if you have a primary care provider, as you get older, the primary care providers should be evaluating you on a routine basis and be checking out if you are predisposed to that, especially if you find yourself gaining weight, you're aging, or you start having multiple problems that may be akin to that. More often than not, people talk about waking up at night to go and pee. That may actually be from a urinary problem. But if you're a younger person that is not likely to have that urinary problem, and you find yourself peeing too much, what we call polyuria, you have to go and pee, come back, it may be a urinary tract infection, it may even be sexually transmitted problem. But if it's not showing any other thing but just the excessive peeing, that may be that the person is being diabetic. Now, unexplained weight loss can also be a diabetic. When I was in school, diabetes was described as the child who's the cells that starve in the excess of glucose. So there is excess glucose in the circulation, but it's not getting into the cells because of the relative or absolute absence of insulin, which drives the glucose into the cells. So the glucose is actually the fuel or the gasoline that drives the cells that make up every unit of your body. Now, when it can't get into the cells, it just pulls there and drags fluid out of the cells, causing the cells to, kind of get dry and then lyse and die. So that is the illness you manifest. So you have people who are so dry because of too much glucose in their extracellular fluid that is not, due to the excess sugar that is out there that is not getting into the cells. So those are the early features. But in the later, as you go on, then it starts affecting different organ systems. And those organ systems more often are affected because of poor circulation that is generated from the diabetic process. But in the foot, in addition to the poor circulation, there is also the nerve damage, which tends to affect the foot more predominantly than other parts of the body. Keep in mind, we are bipod human beings. That means we walk only with our 2 feet. We're not like the tetrapods, like the gorillas that tend to use all 4 limbs to walk. So that provides a huge challenge for us in terms of what this whole illness presents. So sudden weight loss, sudden weight gain, and then you are getting more tired. You have a predisposition to infection. Every infection that comes by gets at you, and it's very severe when you have it. You don't have a strong immune system. Those are things that point to us that maybe this person needs to be checked out for diabetes. And you just do a simple test when you see your doctor and they're able to make the diagnosis if your A1C is above the normal limit.
So Doc, I had a conversation with you about diabetes in your office, And one of the things you talked about is how differently you notice that treatment to say a diabetic who has a wound on the leg or the foot, how different you've acknowledged. You've seen some doctors caring for those patients. Can you talk a little bit about what you've noticed, what you've seen?
So yeah, so the diabetic is almost seen as the problem child. That patient who is going to be seen by several doctors. There's a way we describe them in the wound clinic, that you have a wound clinic, they go from the wound clinic to the kidney doctor. From there, they see the heart doctor. Then they go to the vascular clinic because they have all these problems.
Mm-hmm.
And when you have too many problems that seem to be leading you down the alley road, there's a chance that at least one of them will most likely get you at some point. Yeah. So that, by itself kind of burdens the providers that are taking care of them. And there's always this notion that most people become diabetic or their diabetes is not well controlled because they are not taking good care of themselves. They are not as diligent in obeying the instructions of what they are given. They are not able to just discipline themselves and control their diet, control their activity, those things that make a healthy living. That is one way of looking at it. But another way of looking at it is the diabetes itself provides an incapacitation that actually tends to push them further down that track where they are not able to do those things that they need to do. Just take, for instance, if you have a diabetic foot ulcer, it limits your ability because of some ongoing diabetic foot neuropathic condition or vascular problem. That limits your ability to ambulate freely, or you can't be engaging in exercise like swimming or running with others when your limb is a challenge. So that ability to move out of that metabolic zone is kind of it provides a unique challenge. But the good news is there's been a lot of breakthrough in the treatment of diabetes. Today, there are so many options of what you can use to improve your diabetic control. You just need to keep pushing and, till you get a provider who can make sure that all those options are tested out to give you the best in terms of the results. And if you go through the right hands, you probably get a better control of the diabetes. And the more you control the diabetes, for instance, we know that the diabetic neuropathic problem is not easily, does not get reversed, but at least the progression can be slowed down if you can control your hemoglobin A1C. So while you treat it, you monitor to make sure that there is progress. And if you can just stay with it, there's a good chance you can actually get better control and better life out of it. I tell some of my patients that the diabetic is a lucky person because he tends to see more doctors and more frequently. And if he is persistent, there's a good chance that the combination of all this knowledge and skill will make them live longer than the other people who are not diabetic. So while that is the case, there are also some scenarios where the limb loss and other comorbidities that challenge them kind of look like maybe they don't get the best of care, which happens when you have so many problems.
So doc, now if I'm dealing with my A1C, it's high,
yeah,
and I've got these terrible eating habits, and now I've ended up in a nursing home, okay. And they told me now, okay, I need to chop that leg off.
Okay. So that's where someone like me comes in. If you have been offered to lose your limb, I have enough expertise to see if there's a way to salvage that. And that's where you can come to my clinic. And I'll look at the options available to see because I believe that the more you lose, the more the limb loss there is, the more you push the patient down the alley road of inactivity, more weight gain, depression, and ultimately the person who falls out of the workforce. But if you can find a way to salvage the limb, you may just improve that person's spirit and be able to give enough support to that person to drive them onto the other side where they can get out of there healed and then be more productive members of the society. And that's kind of the theme that's driven me to open up my clinic.
So you're saying that there are possibilities for people who have diabetes and they've been told now that their limb should be cut off.
Yes, if no matter what the situation is, if there's a bone infection, if there is an abnormal formation, if there is some deformities, like if you have had what we call clubfoot formation as a consequence of the charcot joint, those are things that we can manage. We can heal the ulcer by providing adequate orthotics to offload the area of interest. So what happens is that as you lose the nerve supply to the lower extremity, the way the foot is designed primarily gets lost. So if you imagine a child that is born and he has a footprint, that footprint is lost as diabetes starts affecting individual joints in your foot. So the mechanism that you're designed to work with becomes altered. One of the things that you can find in that foot is calluses. And calluses, the way I describe it to my patient is if you have somebody who walks with his hands and you touch that person's hands by shaking them, you'll see that the hands are calloused. Those hands, the hands have been overused. That's why they are forming calluses as the way the hand tries to save itself. The same way with the foot. If the foot that you are born with, the footprint is being lost, it means that the weight is redistributed in a way that different sections of the foot that wasn't designed to bear weight are now overbearing in terms of weight. And the way the foot tries to cover for itself is to build calluses. Those calluses ultimately become the sticking point, because you imagine a piece of callus is like a piece of calcium or stone that is attached to somewhere on your foot. So at some point, the normal tissue is crushed between the callus and the bone skeleton that you have. And that's where the ulceration starts. Add that to the poor circulation, add that to the ongoing nerve damage, add that to the poor immune system that can fight off infection, and the limited activity and poor circulations from even the heart not working well or the kidneys not working well or the person swollen as a consequence of all this. And that just creates the perfect storm that will just ultimately get rid of that limb. And the way the patient sees it is they think they expect you to be compassionate with their problem. But the way the system works is most people will not have time to want to save the limb. They will just prefer to cut it off and just get on with it. And honestly, if you ask me, it's more profitable to cut a limb off from the surgical perspective than to waste time trying to save it. And that's where we come in. We try to find ways to save those limbs. We're not just focused on the money of trying to have a limb cut off. We will try our best to save that limb and keep you functional in your work environment.
So, Doc, what is one thing you wish every diabetic knew about wound care and self-advocacy?
I want them to know that today there is a lot more available. Like I just mentioned, the hyperbaric chamber system that tries to give you oxygen delivered even when there is compromise in your body being able to deliver oxygen to certain tissues. The hyperbaric is able to force oxygen down there and salvage and keep the tissue alive. As long as oxygen is available, the tissue can be alive until the other aspects of what is causing you to lose have poor circulation there may improve or get better. So think about it like somebody has had a surgery and then the tissue flap is now looking like it's about to die. If you put that person in the oxygen chamber, you stand a chance that that flap of tissue may survive, and give the surgeon and physicians time to get that tissue to actually find a way to exist and not get lost, as against the scenario where there was no oxygen and that tissue dies and you have a huge tissue loss. The same with a limb. If you have a limb that is not performing well in terms of poor circulation, and oxygen treatment like that can actually help get it functioning back. And those are the things that are available today in remarkable number. There are so many clinics that have this oxygen. All you need to do is to understand what it does and how it helps you get better, and you can use it. And it's also been shown that people who have bone infection can actually benefit from it and recover in most cases. So what I do is to see whether the use of oxygen in hyperbaric proportions alone or in combination with antibiotics that are now much more advanced antibiotics options can get your wound to heal, unlike what you had several years ago when you were just subject to just limb loss. So there are opportunities today in wound care that actually make it possible to salvage limbs that would have been condemned in the years past. That's the message.
Awesome. And so, Doc, the last question: how can people stay informed and reach out to a specialist like you for help when they need it?
Well, I think on the screen you can see my clinic phone number and web page. I will do my best to get some blogs out to try to inform the population through the web page. You can always call my clinic and schedule an appointment and talk to me. I'm not the only wound doctor available. There are wound doctors almost everywhere. You just need to pick one and stick with that. But what I can tell you is what I can do for you. I can give you assurances of what my experience have led me to this point, which I can utilize to make you better. I'm looking forward to the encounter in the library where I can actually show pictures of patients who have benefited from care, who were told they were going to have their limb cut off, and they were able to walk with me and get their limb still with them today.
So, Doc, let me just say your phone number for anyone who is looking to find. First of all, are you accepting new patients right now?
Oh, yes, I am. I am accepting new patients. Okay. I just opened the clinic and we're just building our patient population at this point. Yeah. So wonderful. It's an opportunity for you to cash in before we run out of opportunities for the clinic. But I don't see us getting there. The thing about wound is the wound starts and it ends. So the patients are constantly moving on, unlike the ideal primary care clinic where you have patients with chronic conditions that keep coming back and forth. Most patients with wounds are healed and then they move along.
Do you provide primary care?
I do provide primary care, and then post-surgical patients I do provide, and preventive care as well. We try to make sure that we get you all good to go back to work.
Okay. And your phone number is 513-306-4910. And your web address is www.strichardsclinic.com. strichardsclinic.com. All right. Well, Doc, I just want to thank you again for being with us this evening. And you did mention that you and I will be at the library in Westchester, Ohio. That is on July 30th from 6:45 to 7:45 p.m. in the community room at the Westchester Library, community room A and B. So as soon as they come into the library, they will see the community room is right there in that hallway when they enter. We will also be together at the Mason Public Library on August 5th from 7 to 7:30 in the Park Hill room. And so if people are anywhere around the greater Cincinnati area, you are welcome to attend either of those events, either at the Westchester Library or the Mason Public Library. So again, thank you so much, Doc, for joining us. And if anyone has any questions, they can give Dr. Obioha a call at 513-306-4910. And St. Richard's Clinics with an S on the end.com.
All right. Thank you so much for having me. I appreciate it.
Oh, thank you. And I look forward to our further conversations on this topic.
Same here.
All right. Thank you, Doc.
Okay.